When people hear Hantavirus, they picture a dusty cabin in the desert southwest, a deer mouse nest in a woodpile, a 35% fatality rate. That version is real. It's also irrelevant to 90% of the population. The hantavirus already circulating in American cities lives in a different animal. It attacks a different organ, it kills at a different rate, and no hospital in the country is routinely testing for it. Most people will hear about hantavirus this month because of a cruise ship. One sentence on that. The MV Hondius case involved Andes virus. Different strain, different continent, different context. What that headline won't tell you is what's already living in the sewer line beneath your basement floor. 5 preparations: structural, medical, diagnostic, logistical, and communal. Each one closes a gap between what this virus can do and what the system is currently set up to catch. And each one has a fatal flaw you need to understand before you trust it with your life. Here's what you're actually dealing with. Hantaviruses split into 2 families, and the difference between them is the difference between a wilderness campfire story and an urban public health crisis. New World hantaviruses. Sin nombre is the famous one. Host animal is the deer mouse. Target organ is the lungs. Fatality rate sits around 35%. It fills your lungs with fluid. You drown from the inside. It's horrifying. It also lives in rural areas with low population density. Since 1993, the entire country has recorded roughly 890 cases, total in 3 decades. Old world hantaviruses. Seoul virus is the one you haven't heard of. Host animal is the brown rat, Rattus norvegicus, the Norway rat, the sewer rat, the rat that lives in every major city in this country. Target organ is the kidneys. Fatality rate runs 1 to 2%. That sounds low. Remember that number. We're coming back to it. Transmission works 3 ways. The primary route is inhalation. Rats urinate, defecate, and nest. That waste dries. It becomes dust. You breathe the dust. You're infected. Second route is direct contact through broken skin or mucous membranes. You touch a contaminated surface with a cut on your hand. Third route is a bite. That one's rare. Here's the critical behavioral fact. Infected rats show 0 symptoms. They shed virus for their entire lives. They look identical to uninfected rats. There is no field observable indicator. You cannot tell by looking. Nobody can. The clinical progression follows 5 phases. Febrile. You spike a fever. Headache. Muscle pain. Looks exactly like flu. Hypertensive. Your blood pressure drops. Hemorrhagic signs appear. Oliguric. Your kidneys start failing. Urine output drops sharply. Blood appears in your urine. Creatinine spikes. Diuretic. If you survive, kidney function begins recovering. Massive fluid output. Electrolyte chaos. Convalescent. Slow recovery over weeks to months. Now here's the part that should concern you. Standard serological assays in American labs are optimized for Sin nombre virus. They're poorly sensitive for Seoul virus. Your doctor can't just order a hantavirus test and catch it. A clinician has to specifically request Seoul virus testing from the CDC. Most urban emergency physicians have never seen a case. They wouldn't think to order the test. No antiviral exists. No vaccine is approved domestically. Treatment is entirely supportive. Fluids, monitoring, dialysis if your kidneys fail. That's it. The most dangerous thing about Seoul virus is not the virus itself. It's the fact that no one is looking for it. If you're the kind of person who pays attention to the patterns that fall between the cracks of public awareness, subscribe to this channel. That's what we track here. Let's talk about what you can actually do. The first preparation is structural rodent exclusion. This is the foundation. The CDC identifies it as the single most effective measure against rodent-borne disease. The specification is precise. Any gap larger than a 1/4 inch must be sealed. A 1/4 inch. That's roughly the width of a pencil. A juvenile rat can compress its skull through any opening its teeth can reach. The materials are cheap. Hardware cloth, steel wool, copper gauze, silicone cork, sheet metal flashing. Total cost for a single family home runs under $200. The mesh spec is 1/4 inch 19 to 24 gauge galvanized. You can complete the work in 1 to 2 weekends. A properly excluded building stays rodent-proof for years with semi-annual inspection. Your inspection checklist covers the entire building envelope. Foundation perimeter, every utility penetration, gas lines, water lines, electrical conduit entries, door frames, especially at the bottom corners, soffit vents. Dryer vents, plumbing cleanouts. Any point where something passes through a wall is a point where a rat can follow. You seal each one, you check them every 6 months, you maintain the barrier. A person who does this correctly has eliminated the primary entry pathway into their living space. The cost is minimal, the labour is moderate, the protection is substantial. Now here's the fatal flaw. This works only on the building you control. 36% of American households are renters. In a multifamily building, a single unsealed utility chase gives rats access to every unit in the structure. Your neighbour's problem becomes your problem through the wall cavity you share. Sewer-connected plumbing is the overlooked highway. Rats travel municipal sewer systems and enter buildings through deteriorated lateral connections, uncapped cleanouts, even toilet drains. In pre-war housing stock, the kind that dominates the densest neighbourhoods of New York, Chicago, Boston and Baltimore, a single structure can have over 100 potential entry points. Comprehensive exclusion of an old apartment building requires landlord investment. That investment is systematically absent in the neighbourhoods with the highest rat density. The buildings most likely to have rats are the buildings least likely to get sealed. You can exclude your own home perfectly. Your neighbour's basement is still open. The second preparation is assembling a decontamination kit. This matters because the most dangerous moment is not the presence of rats. It's the cleanup. Sweeping or vacuuming dried rodent waste aerosolizes viable virus particles. You turn a surface contamination problem into an airborne exposure event with a broom. The CDC protocol is simple. The total kit cost runs under $30. Household bleach, a spray bottle, rubber or nitrile gloves, an N95 or P100 respirator, paper towels, sealable plastic bags, eye protection, goggles, not glasses. Every item is available at any grocery or hardware store. The kit stores indefinitely. You mix fresh bleach solution before each use. The protocol runs step by step. Ventilate the area for a minimum of 30 minutes. Open windows, open doors, get air moving. Mix a 10% bleach solution. That's 1.5 cups of household bleach per gallon of water. Spray the contaminated area thoroughly. Soak for 5 to 10 minutes. Pick up the waste with paper towels. Never sweep, never vacuum. Double bag everything in sealed plastic bags. Mop the area again with bleach solution. Remove your gloves by turning them inside out into the bag. Seal the bag. Wash your hands thoroughly. A person who follows this protocol correctly has reduced their inhalation exposure to near zero. The materials are cheap. The process takes less than an hour. The protection is real. Here's where it fails. The protocol breaks at the step most people skip. Respiratory protection. An N95 respirator must be properly fitted to achieve its rated filtration efficiency. You press it to your face. You check the seal. You feel for air leaking around the edges. A standard dust mask, the kind most people grab from under the sink, does not protect against viral particles. It's a comfort object, not a barrier. Most households don't own N95 respirators. Those that do often store them improperly, crushed in a drawer, elastic bands degraded. A person who follows every other step of the protocol perfectly, but wears a loose-fitting dust mask, has left the primary inhalation pathway wide open. You did the work. You missed the one piece that mattered. Second problem. The 30-minute ventilation step requires operable windows. Interior rooms don't have them. Windowless basements don't have them. Enclosed crawl spaces, the exact locations where rodent contamination concentrates most heavily, may have no ventilation options at all. The line between a manageable cleanup and a professional hazmat situation is not clearly marked. You're expected to know the difference. Most people don't. Now we shift from what you do to your environment to what you know about your own body. The third preparation is symptom recognition. This is where the information changes from practical to medical, and it's where most people's understanding stops completely. The two hantavirus syndromes attack different organs on different timelines with different fatality rates. But they share a prodromal phase that looks identical. Fever, headache, muscle aches, fatigue, nausea, abdominal pain. Duration is 2 to 7 days. It mimics flu perfectly. During this window, nothing distinguishes hantavirus from 100 other infections. The critical differentiator is what comes next. Hantavirus pulmonary syndrome. Coughing starts. Shortness of breath accelerates. Fluid accumulates in the lungs rapidly. Respiratory failure can develop within hours of the first cough. This is the dramatic version, the one that kills 35%, the one you've heard about. Hemorrhagic fever with renal syndrome, blood pressure drops, hemorrhagic signs appear, bruising, petechiae, urine output drops sharply, blood appears in your urine, creatinine levels spike, acute renal failure becomes the immediate threat. This is the Seoul virus version, the one you haven't heard about, the one living in the rats outside your building right now. A prepared person who develops fever and muscle aches after any potential rat exposure and then experiences either respiratory decline or reduced urine output seeks emergency care immediately. That's the recognition piece. But here's the piece that actually saves your life. You tell the physician about rodent exposure. You say the words out loud. I had contact with an area contaminated by rodents. That statement is the diagnostic key. Without it, the physician has no reason to suspect hantavirus. Here's why the diagnostic window is so dangerous. Hantavirus cannot be reliably detected by blood test until 72 hours after symptom onset. 3 full days, you can be infected, you can be symptomatic, you can be sitting in an emergency department, and the blood test comes back negative because it's too early. The prodromal symptoms you're presenting with, fever, muscle aches, fatigue, describe roughly half of all emergency department visits. Without a volunteered rodent exposure history, an urban ER physician has no clinical reason to think hantavirus. The 2018 DC case was caught because occupational rat exposure was documented. The 2017 pet rat outbreak across 31 facilities in 11 states was caught because rodent contact was obvious. But an urban resident who contracts Seoul virus from a contaminated basement or a sewer splash during a street flood may not even know they had rodent contact. They present with fever and kidney dysfunction. The differential diagnosis list runs a dozen entries long. Seoul virus is not on it. Here's the number that should reframe everything you thought you knew about this disease. 96% of all reported hantavirus cases in this country occurred west of the Mississippi. The entire surveillance architecture faces the wrong direction. It's pointed at the desert, at the deer mouse, at a rural threat pattern that kills dozens of people per decade. Seoul virus concentrates in eastern urban populations, in the rats of New York, Baltimore, Philadelphia, Boston, Chicago. The system is looking where the threat used to be, not where it is now. New York City alone has an estimated 3 million rats. That population increased 51% since 2010. In Baltimore, researchers found 48% of wild-caught brown rats tested seropositive for Seoul virus, nearly half. Nobody is screening patients for it. Nobody is systematically testing the rats. The surveillance system is blind on both ends. The fourth preparation costs you nothing but time, and it could be the difference between dialysis starting in 2 hours versus 12. Map your nearest appropriate medical facility. This is not find the nearest ER. This is identifying the nearest hospital with a functioning nephrology department and an ICU capable of performing emergency dialysis. Many community hospitals and smaller emergency departments can stabilize a patient. They can run fluids, they can monitor vitals, they cannot dialyze. In a Seoul virus case progressing to acute renal failure, you need a facility that initiates dialysis within hours, not one that stabilizes you, loads you into a transfer ambulance and sends you to the facility that can actually treat you. That transfer costs hours. While you're in the ambulance, your kidneys continue to deteriorate. Large academic medical centres have this capability universally. Tertiary care hospitals have it. Your local urgent care does not. Your community hospital may not. The preparation is simple. Identify the nearest dialysis-capable facility. Know its name, know its address, know the fastest route. If you live in a suburban or exurban area, that facility may be 30 to 60 minutes by ambulance. Now here's the tool that bridges the gap between what you know and what the emergency physician will think to test for. Create a medical information card, wallet-sized, or a note on your phone. It lists 3 things: your potential rodent exposure history, the words "Consider Seoul virus HFRS," and the instruction to request Seoul virus-specific antibody testing from the CDC. You hand this to the triage nurse. You show it to the attending physician. You make sure someone in that emergency department sees those words. The fatal flaw here is capacity. Identifying the right facility is easy. Accessing it during a multi-patient event is hard. Dialysis machines are finite resources. The country has approximately 7,800 Medicare-certified dialysis facilities, serving roughly 580,000 chronic patients on scheduled appointments. Those machines are booked. Surge capacity for acute hemorrhagic fever with renal syndrome cases barely exists. If you're incapacitated by metabolic encephalopathy from kidney failure, you cannot communicate your own exposure history. You can't hand anyone a card. You can't say the words. A companion must be prepared to do it for you. Someone in your household needs to know what you know. They need to carry the same information. They need to say the words you can't. The fifth preparation moves beyond your household entirely. Community rodent reporting and collective action. This is where individual preparedness hits its ceiling, because rat populations are managed at the neighborhood level, not the household level. A single property that eliminates rats achieves a temporary local reduction. Weeks later, surrounding properties push rats right back. The population redistributes. Your clean building sits in a dirty block. The math hasn't changed. Most major cities already operate rodent reporting infrastructure. New York's 311 system receives roughly 50 rat sighting reports per day. Chicago logged over 36,000 rodent complaints in 2024. These aren't just complaint lines. They create geospatial data that public health departments use to prioritize resources. More reports mean better targeting. Better targeting means more efficient extermination. Every report you file contributes to a dataset that directs where the city sends bait stations and inspection teams. The proof that this works exists. New York's combined measures over the past 2 years, trash containerization, collection timing changes, dedicated mitigation zones, the appointment of a dedicated rat czar, produced a 21% decline in reported rat sightings over a 12-month period. Coordinated municipal effort bends the curve. It works. Here's where it breaks. Community rodent management functions only when the community is functional. In neighborhoods with high resident turnover, absentee landlords, vacant properties, language barriers, poverty, or deep distrust of government systems, collective coordination collapses. Vacant properties provide uncontrolled harborage with no responsible party to fund exclusion work. Baltimore alone has 16,000 vacant properties, 16,000 buildings with no one sealing the gaps, no one setting traps, no one reporting. The reporting systems themselves carry class bias. Filing a 311 complaint requires awareness that the system exists, access to a phone or internet connection, and willingness to interact with a government agency. Underreporting is systematic in the neighborhoods where infestations are worst. The Bronx led New York City in leptospirosis cases in 2023, 24 cases citywide against a historical average of 3 per year. That's an 800% increase. The Bronx, a borough with some of the highest poverty rates in the city. A Seoul virus outbreak would follow the same demographic fault lines, and even a neighborhood that achieves significant rat reduction has no mechanism to determine whether the remaining rats carry Seoul virus. 0 American cities conduct routine Seoul virus surveillance in wild rat populations, not 1. The 2017 outbreak was detected because a human being got sick enough to be hospitalized, not because anyone was monitoring the rats. The rats in your neighborhood could be clean, or 48% of them could be seropositive like Baltimore. Nobody's checking. The Hantavirus most people picture, the one in the cabin, killed 312 people in 30 years. That's documented. That's counted. The one in the sewer system has never been systematically counted. There is no national surveillance program for Seoul virus in urban rat populations. There is no routine clinical screening for it in emergency departments. There is no approved vaccine. There is no antiviral. The preparations in this video are not about surviving a dramatic outbreak. They're about closing the gap between a threat that already exists and a system that isn't designed to see it. Seal the gaps in your building, assemble the decontamination kit, learn the symptoms, map the right hospital, carry the card, report the rats, tell someone else what you know. The most dangerous diseases are not the ones with the highest fatality rates. They're the ones with the highest invisibility rates. A virus that kills 1% but infects thousands because its host lives in your walls will produce more funerals than a virus that kills 35% but touches dozens of people a year in remote settings. The math isn't dramatic, it's arithmetic. And arithmetic doesn't care whether anyone is paying attention. When was the last time you saw a rat where you live, and did you think about what it might be carrying? Drop your city below. Now you know what to look for.